Are your child or spouse snoring throughout the night, drooling all over the pillow, making life difficult for you? Hi, I'm Dr. Rachna Gandipati. I'm a practicing ENT surgeon, and today I'll be speaking to you all about snoring. So what is snoring? Snoring is a sound that is emitted when a person is inspiring or expiring during sleep. Snoring signifies that there is some amount of obstruction. The obstruction can start anywhere from the tip of the nose till our lungs, that is till the last bronchus. Any obstruction there will cause some amount of sound that we hear as snoring. Snoring, friends, is seen both in adults and children, so we'll divide it into two. When we talk about snoring in children, the most common cause of snoring in children is adenoids. The most common cause of adenoids is allergy. So we can say allergic children tend to snore a lot because of adenoid hypertrophy. And how do we diagnose it? We diagnose adenoid hypertrophy in children through the way of a simple X-ray or a nasal endoscopy. But when we talk about snoring in adults, snoring in adults can be because of various reasons. Most commonly, what we see is deviated nasal septum, sinusitis, allergic rhinosinusitis, overcrowding due to weight gain, or sometimes due to other musculoskeletal disorders. So I'm always asked if snoring is a healthy habit. Snoring is a very unhealthy habit. Snoring once in a while can be ignored, but if somebody in your family is snoring every day, there are various reasons for you to take it very seriously. Snoring, like I said, is indicative of obstruction in our breathing pathway, especially when we are sleeping. So friends, I want you to understand, when you are sleeping, your whole body is relaxed, so that there is optimal blood supply and air supply towards your brain. And your brain tends to rest while you are sleeping and tries to re-energize while sleeping. No, in children, when they snore, you see that the child is always hyperactive, they cannot concentrate well, they're not well rested. So these are all symptoms of snoring. And in adults, when they are snoring for a long time, we do observe a fall of saturation. Snoring can slowly lead into sleep apnea, which is a leading cause of death in adult or geriatric age group patients. So snoring can happen with your mouth open or closed. Snoring mostly is associated with an open mouth or drooling. So how do you know if the snoring of your loved one is a serious condition, or if it is heading towards sleep apnea? Sleep apnea is diagnosed through various tests, most commonly a sleep study, which is recommended by the doctor. But at home, if you notice that your partner suddenly wakes up from sleep, stops snoring, and then goes back to sleep within a few seconds, that is a very good indicator or a home indicator of sleep apnea. So before you take the patient to a doctor, what you can do at home, always keep a diffuser or an air purifier close by to your loved one, so that the breathing pattern is a little more easier or smoother for the patient. Always encourage the patient to lie down on their sides rather than lying down on their stomach or straight on their backs. We always recommend our patients to lie down at a 45-degree angle to help them breathe more efficiently and to reduce the abdominal pressure over the chest. Snoring, thankfully, is very much treatable. There are various treatment options available for snoring. When we see snoring in children and we diagnose adenoids, then the most common treatment modality would be medical again. If the patients are not responding to medical management, then the child is advised adenoidectomy, which is a very small surgical process with a very good result rate. When we talk about adult snoring, then the cause of the snoring has to be identified. The point of obstruction has to be identified. Then the treatment modalities will vary depending on the site of obstruction and the amount of desaturation that is happening during a person's night sleep. Medical management for snoring most likely will include lifestyle modification and treating if there are any nasal pathologies or underlying pathologies. Surgical management will include nasal surgery and oral surgeries. So I hope I was able to provide you with some valuable information in this video. If you like this video, please like, share and subscribe. Thank you very much.